On to Faith Communities in Action. This is our first networking meeting of 2026. The acronym that you'll often hear me use is FCIA. And for those that are new, I do see a few new faces. Um, I do see a few new faces, so welcome. I'll briefly just center you on why we're meeting this evening. So, Faith Communities in Action, FCIA is a network of faith communities, community-based organizations, and government agencies that foster interfaith communication and cooperation to build and strengthen human service resources throughout Fairfax County. So I truly appreciate the effort that you all have put in and continue to put in supporting our community, especially by joining this meeting tonight. So this evening, we will have Patty Fehervari. I'm sorry, Patty, and she told me don't worry about it. So I'm going to say we're going to have Patty F, and she will introduce herself. Patty F from our Fairfax County's Department of Family Services, Public Assistance, and Employment Services. And she'll discuss public assistance resources that are available to our community members and the eligibility changes. But before I pass it off to Patty, I do want to share a few announcements just because I know sometimes people need to leave early, so I wanted to get the group together now. So we do have a new Faith Communities in Action flyer. So what I'm going to do now is take a moment to put that in the chat. Please feel free to share this with any houses of worship, oh, and that's weird. It's not letting me add anything to the chat. So what I'll make sure to do is send this out to you all later via email when I send out the resources from Patty. We'll also send out a recording of the meeting. So in that email, you'll also receive the new flyer. We do have it in Spanish as well as English, so you'll be able to share that. And please consider any houses of worship that maybe you work with that you think would benefit from joining, maybe any community members or organizations in Fairfax County. You're welcome to share that and pass that along. The next item that I wanted to share is that tomorrow morning, 9 a.m., you will receive an email from it's FCIA 2026 at publicinput.com. I'm going to put that address in the chat. It's not spam. It is a survey for Faith Communities in Action for 2026. So I want to better understand what are some of the topics that you're interested in discussing? What are some of the ideal meeting times for you? What are ideal meeting dates? What do you want to get out of these meetings? So please make sure that you respond to that email, that survey in the email by 11:59 on February 4th. I will also send out a reminder via via our newsletter, The Common Ground. So you will get a reminder through there as well. But please make sure that you provide your insight. It is greatly appreciated. These meetings are we hope that you will get enough out of these meetings to support your house of worship and your surrounding communities. We want this to be informative for you. So please make sure to give us your feedback. And then let's see. Uh, Also, I just wanted to let everyone know to please put on your calendars now. Our next Faith Communities in Action meeting is going to be at 7 p.m. and that is going to be on got out of there, March 17th, 7 p.m. March 17th, Tuesday, 7 p.m. We will have our Deputy County Executive of Health, Housing, and Human Services, Chris Leonard, come and talk to us about county updates, county budgets, what the landscape is looking like, and how houses of worship can support based off of the information that he's sharing. So I implore you to, if you're not able to, show up in person yourself, perhaps you have a liaison that you can send in your place. This will be a very informative meeting, and you will get a lot of information about opportunities that you can support the county as a whole. I'm working with the House of Worship that may be able to support that meeting, but they're not quite sure. So if you are a house of worship specifically in the Herndon Reston area that's interested in hosting, hosting will consist of opening up the space around 6:30, wrapping up around, I would say 9, and then providing light refreshments, coffee, tea, some snacks. Again, we're looking specifically in the Herndon Reston area. If you're able to support that, please reach out to me via email, and you all have my email address because you are here with me today. All right, so I believe I have covered everything. So without further ado, I will pass it off to our presenter, Patty.
Hi, everybody. I recognize some faces, so I don't know if you caught Lindsay and I making fun of my new last name. It was the marriage herd across the everybody because like I realized that I know Gwen, but Gwen knows me as Araujo. So hi, Gwen. Shout out to you. It's nice to see you. Um, and so, yes, so my name is Patty Fehervari. I work for the PAYS Department of Family Services. We do benefits. So think about Medicaid, SNAP or food stamps, financial assistance. We run the employment centers. We do a lot of energy assistance year round also. And so the financial assistance as well. And so that's kind of what we're here to talk about today. I do not have a presentation. There have been so many changes that really one of the things that was interesting, and those of you who do recognize me might know me from the COVID days, because I was the one basically on tour letting people know like these are all of the different changes. This is, how people can stay connected and kind of like all of the temporary exceptions and to the rules that were happening. So if you remember me, it's probably from that. But what I do have is during COVID, one of the things that the state did that was really, really on time was they did such a great job of updating their websites. And so what you're going to see is I'm going to be clicking around showing you a bunch of different websites and how to access information in real time. And then what I'm going to do is that based on whatever questions you might have for me, I'm going to send Lindsay a list of all of the websites that I'm showing you all so that you have not only my contact information so that you can get a hold of me should you have any issues or questions, but you'll have all of the websites all in one spot. And so all of the resources will be there. So let's have some fun. It's Tuesday night. Feel free to come off of mute. You can raise your hand. You can. I'm watching the chat. So whatever works best for you. But don't wait until. Please interrupt me. I'd rather address your questions as we're talking about it than wait to the end where it's kind of like maybe just lost or a moot point. So let's go ahead and get started. So the what you're looking at on my screen right now is the Cover Virginia website. And so Cover Virginia is like the Medicaid website. So this is where they have all of their information. They've done a really great job. They have a chat feature. So if you're looking in the bottom right hand corner and it actually works, I asked it a hard question, so harder than how do you apply for Medicaid, and I could tell I got a person. So it went through the process of giving me like the regular prompts, but I tried to ask a hard question and I was able to get a response. So it's great. It actually works. But this is where they've done a great job of kind of like just putting what is going on. So like during COVID, we weren't doing any the federal guidelines was that no renewals were to be done with a handful of exceptions. No one was supposed to come off of Medicaid. Of course, it's a public health emergency. You don't want people losing health insurance. And so then last year we went back to doing renewals. And so they did a really great job of keeping this updated and telling people like we didn't do renewals for like 5 years almost. And so one of the issues when I talk to people and they always want to ask like, why do people get disconnected from their benefits? Is it because they're over income? Is it because changes in policy? And to be honest with you, what it is that follow through. So when people are approved for Medicaid, so Medicaid covers, any stuff exactly just like our health insurance that we might have through work. So think about like um, the doctor, prescriptions, hospital visits. A new thing that they added for our adults is dental coverage. That was previously just for children and for pregnant women. I think it was about 2 years ago it changed. So that was a great change. But one of, staying connected with benefits, once someone's approved, they have to renew their benefits and in a year. And so what I always like to tell people, because I feel like it's very kind of counterintuitive and people have a lot of assumptions just kind of given, the technology, is that you would think that the system has a way to push out a text or an email that says, hey, your renewal is due, because the dentist does it, right? I mean, the dentist, your hairstylist, the doctors, they do it. No, everything is pushed out through paper. So you can imagine that what a problem that causes for me when people move and don't tell me. So if you look at my data, and this is something that's been for years, so it's not like it's gotten worse. It's just I just haven't figured out how to fix it. And this is where you guys come in, because really, as you're working with families, that's the one thing that you can do is advocate that they make sure that if they move, they let us know, because that way the mail is going to the correct place. But I have a return mail problem of about 30%. Yeah, that's a big number. That is a big number. And so that's all people that didn't even get the renewal, to know that it was something that they had to complete. So the other piece of why a lot of people get disconnected from their benefits is that, okay, so let's say they do get the renewal. They submit it and they think that that's it. I'm done. And what's going to happen is I'm going to receive that renewal, and the same is for SNAP, except for SNAP, there's a interview that happens. But for Medicaid, we do not have to talk to people. And so I'm getting your application, I'm reviewing it, and I'm saying, oh, hey, Lindsay, I need proof of income. I need proof of this, proof of that. And so if Lindsay doesn't return it, guess what I'm doing? I can't determine if she's eligible moving forward, and that's where people get discontinued. So two big areas. It's that the applications aren't even getting to them, and then the follow through of the verification process that's important. So this is the information about Medicaid. The one thing that I will tell you about Medicaid that's unique, so it is the only program that people can apply for retroactive benefits. So that's important. So they can apply up to 3 months prior. So let's say I applied today, but I've been in the hospital for a couple months. And so there's a question on the application that says, have you had any bills in the last 3 months? And so I can determine if they were eligible for services in the months of October, November, and December. If you told me you had bills in September, that's too late. We're going to have to find another avenue for you to get those bills paid, but I can go up to 3 months. Now, I understand that there's a lot, you may have been watching the news, it's kind of hard to ignore. There's a lot of changes coming down the pike. That number is going to go from 90 days to 30 days. So 1 month, so that change will come down the pike. We don't know exactly when. I'm hearing a lot about October this year, but again, we get our direction from, and I bring that up because I know that you're seeing the news, you can, all kinds of stuff, social media, but we get our directive from the state. So until the state says, do this, whatever you might be seeing is not something that has gone in through the implementation phase in the state. So just throwing that out there. The other thing that's unique about Medicaid is people always want to ask and say, they're like, okay, well, how do you determine eligibility? How do we know if we're eligible or not? And what's unique about the Medicaid program is that there are different requirements and income limits depending on the applicant. So a 40-year-old who is disabled will have different eligibility requirements than a 40-year-old who's pregnant. So the rules are different. As a matter of fact, the rules are different for all the programs. So talk about keeping some keeping me employed. I've made it an entire career of all of the programs being so different and all of them having different eligibility requirements. It's certainly job security. But I say that to you all because it's not unheard of if someone came to you and said, I was eligible for this, but not for that. So I'll give you a perfect example. So undocumented pregnant women. There was a change to policy a couple years back where pregnant women are eligible for Medicaid if as long as they meet the income test, even if they are completely undocumented. Now, if you look at the SNAP program or my financial assistance programs, she would not be eligible. And so I say that that's counterintuitive. I've got a pregnant woman. I want to make sure that she's healthy and provide some of the, the nutritional stuff that she needs, but I'm not going to do that, but I am going to give her medical insurance. So I just want to put that in your mind that it's very possible that happens. It's very confusing to people. So that's why I always try to make a point to bring that up so that you all are familiar with that and think, oh, okay, well, I'm not saying that you can't call and, I'm just saying that it happens. And I think a lot of times people thought that I'm eligible for one thing. It's kind of like a package deal. It is not. They all have different income limits. They have different eligibility requirements. So you will find that there's some people that are eligible for one program and not the next one. Do we have any questions about Medicaid before we keep going here? All right, I'm watching the chat, so I'm going to go ahead and keep going. So let's talk about SNAP. So SNAP is used to be called food stamps for 1,000 years. The name changed somewhere between 15 and 20 years ago. I don't remember anymore. I'm just showing my age now. Um, it used to be called food stamps because people actually received the benefits, and it was like a little coupon book. And so you would go and you would use that to pay. Years ago when it changed, now it's on a debit card. So it looks just like a debit card. You might have heard a lot about scamming and skimming. So one of the things that happened was that at the stores, the participating stores, people would go and they would use their EBT card and their benefits would get stolen. And so for, I don't know, the better part of a year, we were replacing benefits. In the state of Virginia, it was in the millions that were being stolen. And so, this is a food benefit where people can purchase food. And so this is the FNS website that talks about what people can buy. So they can, I'll read this to you all if any, just in case anybody is driving. Let me see, where is it? They've done such a great job updating this that they really do. It's been moving some stuff around. Let's see. Let me go back. There we go. What kinds of stuff can you buy? So you can buy fruits, vegetables, meat, poultry, fish, dairy products, breads, cereals, other foods such as snack foods, non-alcoholic beverages. You can also actually buy seeds to grow your own food. What you can't buy are things like beer, wine, and liquor, cigarettes, tobacco, food drinks containing controlled substances such as cannabis, CBD, vitamins, medicines, supplements, live animals, with the exception of like shellfish, foods that are hot already. And then, or like, so think about like the rotisserie chickens, and you can't purchase any type of pet foods, cleaning supplies, or hygiene items. One of the things that I think is interesting is that the food, so while they can't purchase it with SNAP, I've visited a lot of the food banks in this area. Now I can't vouch for all of them, but one of the things I've noticed is that they're sensitive to this, and there's an awareness about this. And so some of the food pantries have some of these things like shampoo, soap, feminine hygiene products, things that you would not be able to purchase, but that you might not think that you might find at a food bank. So that's just something to kind of keep in the back of your mind as you're working with families. We'll talk about some other resources for food that I want to make sure that you all are aware of. The other thing, so you have to go somewhere that accepts SNAP, okay? Now, something new that, again, you would think like it would be something that was happening during COVID, not because of COVID, but during COVID, they launched a pilot program where places like, think about that do like Instacart, and you can get stuff through like Giant or something where they have Peapod. You can use your SNAP benefits to do online shopping. And at first there was only like 4 stores, but if you're looking at my screen, there's Aldi, Amazon, some of these big like wholesale club like BJ's, Costco, where people really can get like their good bang for their buck. All of these places, they can use their SNAP card to order their groceries online. Now, again, I said this happened during COVID, and we all remember that was a really good time. That was really good timing for this to come up. So the only thing to be mindful of with this would be that if they are purchasing, let's say, I want to get some eggs, milk, bread, but I need toilet paper. you have to have a different method of payment for that toilet paper and a different method of payment for any delivery fees that might be associated. So just something to kind of keep in the back of your mind. But going back to the replacements and the cards being skimmed, one of the things that because of that and how bad it was, we are no longer, it's been a year. It's been since December 9th last year, or the year before, I should say. Um, we got we got guidance that said we no longer can replace funds. So people are just losing their money. So it becomes really, really important that we promote the Connect EBT app so that people can lock and unlock their cards when they're going to use them. And that's one thing that the states are doing. Just for background and to kind of put things in perspective, why is this even happening? It's because this is actually really interesting. So it's because the EBT cards don't have a chip card. It doesn't have like that little chip on it, like yours and mine would, and so that is what's causing the skimming to be able to happen. And so states are banned, but of course it costs money, right? So it costs money to get the new cards and have the technology, and now we have to get the retailers the appropriate stuff so that they can, the people can use those cards. But states are banding together. So if you look at the FNS website, there's some states that are banding together and they're saying, no, this is something that is a matter of being equitable and treating people with equity, and they're entitled to have that protection as well. So states are coming together to do it. Virginia has advocated for it. It is not happening yet, but it is something that state of Virginia has said that they are willing to do. So, so again, with the SNAP, let me go click on over here. So this is the public facing SNAP website. Oops, nope, no, it's not. This one is. And so there's great information in here. And one of the things that I was going to send to you. So what happens when somebody applies for SNAP? So when they apply for SNAP, Medicaid is the only one that doesn't require an interview. All my other programs require an interview happen. And what's great about that is that at this interview, I get to say, well, Lindsay, who do you live with? How are you all related? And so that helps me figure out what verifications I'm going to need from her, who needs to be in her household, who can be excluded, and how many people are going to be eligible. And so during that interview, I'm asking all of those questions. One of the things that, again, they've done a lot of great work in the last year. One of the things I'll be sharing with you all is this flyer that kind of tells people what's going to happen at the interview. Is it in person? We really don't do in-person interviews. I do have the ability so that if somebody walks into my lobby and they're homeless, for example, maybe they don't have a phone. I am not going to tell them, well, come back next week. I do have staff that are basically just waiting for those types of situations when that happens. So yeah, lets them know like what kinds of things are we going to need. One thing that I will tell you that it has changed, especially for those of you that have been around, I always say know enough to be dangerous. You'll remember that a lot of times, like for example, when someone said, well, how much do you pay for rent? We would accept the customer's statement. So one of the changes that came from the HR1 bill was that now we need to verify any of those expenses. And it has to do with the payment error rate in the state of Virginia. So proper QC from the state, so USDA, FNS, they read our cases every month. And so if I give someone too much SNAP, then that is what contributes to my payment error rate. So it calculates, what they were supposed to get versus what I gave them. And then that difference goes into creating giving us what the payment error rate is. The state of Virginia as a whole is just over 11%. And so we have been instructed that states that are over 6%, so I just told you I'm at 11, right? So anyone that's over 6%, that state is going to be required to now pay some SNAP funds. And so there is a financial component there. And so that's contributed to the change. Is that what would happen is that, let's say, for example, I would say, Lindsay, how much do you pay in rent? Well, Lindsay lives in Crystal City, and so her proper rent is $1,200, but then she has to pay $100 for a parking space. So Lindsay tells me 1,300, right? That's what she pays every month. But then when QC reads that case, they're like, well, Lindsay, I need to see your lease. And guess what? That parking space isn't covered for. So now I have given Lindsay SNAP based on $1,300, which really is $1,200. And so I've given Lindsay more than she was entitled to. And guess what happens now? Lindsay's got to pay it back. So aligning how we determine eligibility and how they determine eligibility is why this is all happening, because we need to make sure that we're both looking at it through the same lens. And so I say that because I feel like this just happened in November. And so if you're hearing from the families that you work with, gosh, they're asking for a lot of stuff that they didn't ask for before. It's okay. And that should be normal, because we are asking for a lot of things so we're asking for proof of medical expenses, childcare expenses. Now, all of these things, it's to their benefit to provide a verification of that, because unless they're receiving the maximum, all of those expenses, I'm giving them credit for that. So they might be entitled to, they're likely entitled to receive a higher SNAP amount each month if those expenses are provided. So just some things to kind of keep in mind that have been happening recently. So this just goes over telling them, what kinds of questions we'll be asking. I mean, there's always a citizenship and income component that's there. So those are things that we'll ask for likely. All right, any questions about SNAP? How are we doing? All right.
No questions in the chat. I'm
All
looking
right.
too.
Yep. Okay. Um, the next type of services that we provide is financial assistance. So this is there used to be a program for adults with disabilities. It was called General Relief, and I see the question in the chat. Thank you, Lindsay. You got my back. Thank you. So that is their funding ran out for that, and so that's no longer a program that we offer. We only offer financial assistance for families with children that they are either related to, which would be the TANF, if you're looking at my screen, or children that they are not related to but caring for. So related to could be by blood, so blood, marriage. So think about my niece, my nephew, my cousin, maybe I'm an adult sibling taking care of a younger sibling, whereas maybe under the other program, it would be somebody who's like maybe my godmother, who I've known, who's been best friends with my mom since they were kids, but we're not related by any type of blood. There's also a flyer for TANF that I'll be sharing. So that's just another resource for you. There's now TANF is a monthly payment program. One of the options for household is to imagine somebody says, I don't need this for forever. I lost my job and my unemployment is about to start and I need to pay my rent. So by design, there's a program under the TANF program called diversionary assistance. So think about it. I'm literally diverting somebody from being on TANF for, months and months and months. So it's a lump sum payment that people can receive to help kind of meet some of those expenses. There was also a program for emergency assistance. I wouldn't tell you to worry about, well, which one is which, because remember, this is one program that I'm going to have an interview with them. So I'm going to figure out what you've got going on, and we're going to talk about which one of these is kind of the what better suits your particular situation in that respect. So let me see. I've got a question in here, somewhat of a tangent. I love those. It's okay. Is there anything to help pay for a phone, since you cannot exist without a phone these days for interviews? So one of the things, and I'm sorry, I'm not ignoring you. I just want to make sure I write this down. One of the things that we do when people don't have phones, there's a program, not through us, but we do advise people that they can apply for SafeLink. So SafeLink is a program, it's a third-party company, and basically if you are on any type of public assistance, they will give you a phone. There's also, and I'm sorry, I'm clicking back over here. So once somebody is approved for Medicaid, they transition into an MCO. So these are the managed care organizations that that work with Medicaid. So Aetna, Anthem, Health Keepers, Humana, Centara, and then United Healthcare. And some of these, and I'll be sending this link as well, like Aetna, for example, they'll give you a free smartphone with unlimited minutes, text, and 5 gigabytes of data. So this one, Anthem, they do smartphones. But what's great about this kind of chart is that it also tells you all of the other things that come with the MCOs. So like think about, like I'm reading that this one says Anthem, up to $300 gift card for baby items, diapers, car seats, and more. Some of these have, like this one, for example, under Anthem, it even has Weight Watchers, some money that can go towards Weight Watchers. um, $400 healthy gift card, grocery gift card. A lot of these have transportation assistance as well. So like, for example, this one is Aetna. This one is 15 year-round trips, 15 round trip rides per year. This one is 24 under Anthem, round trip non-medical rides. So this is just a great resource to have. So thank you for that question. That's a great question. I hope that that answered that. All right. So how do we apply for all this stuff, right? So how do we do that? So let me take you now to my public facing webpage. And so if people have questions, they can call us Monday through Friday. We have a call center. The number is here. It's 703-324-7500. We have translators available, so that would not, language is not an issue. I am working currently getting a new phone system where it'll mirror what I'm a little behind, but I don't know if you heard during COVID that CSB CSP has a callback feature. So I'm working on getting a new phone system where I'll have something like that, which is good. If Thank you, Lindsay. I see you. Um, the other thing is that if 8 to 4:30 does not work, one of the other option would be that they can email us at dfsmycase@fairfaxcounty.gov. I have admin staff that's all they do all day is check that inbox. And so Lindsay can email there and say, I have no idea who my worker is. But here's my case number, or here's my social security number, here's my full name and date of birth. And then that person will search her and say, oh, Patty's your worker, and then connect us that way. The other thing that they can use that email for is they can submit not only questions, but we talked about change of address, right? Any changes that they have to their household, they can submit them there, and then I'll worry about who needs to get it. The other thing that they can do is submit verifications. So I just finished telling you that under the SNAP program, there's a lot of changes where now we're asking to verify everything. So how do they get these verifications to us? So way back in the day, we used to have to see originals. I remember I used to have a stamp that I would sign my life away saying that, yes, I saw the original birth certificate. Times have changed. So a couple things. So I do not need to see originals. People can, like I said, I mentioned that, one of the things that there's always that component is proof of income, and then verification of immigration status. They can take pictures on their phone and email them to us. They can, if they're like you and I, where we might get paid online and we don't have an actual pay stub, they can download them and email them to us. We know that there's a lot of families in our community that work for cash wages, right? So one of the things that could happen in that interview is that I'm like, well, Lindsay, what do you do for work? And she's, well, I'm just babysit, and I make $400 a week, but I don't get pay stubs. I babysit for my nieces. Well, guess what I can do, Lindsay? Do I have your permission to call your sister? Yeah, you do. And I can just call and do it over the phone by myself. So it doesn't have to be like a written, notarized document. Um, I'm not going to call and say, well, hey, Lindsay's sister, Lindsay's applied for SNAP. I'm not doing that, right? So, but even if still Lindsay was like, wow, I just don't know how I feel about it, the sister could write Lindsay an email and she could forward it to me and I could accept that. So a lot of different things. I mean, it could be a letter from an employer. It's like, again, it's just gonna, that's the purpose of the interview, to determine, what's the best available. It might be, your business records. It might be taxes, tax returns if you have your own employer, you're self-employed. So it's just going to depend. That's why that interview is so important, because that's when you and I decide what you have, what's the best available. All right. You were going to talk about financial assistance available, or was that the information you shared under TANF? That is the only financial assistance that we provide. So in the form of cash. Now, if and that's a perfect segue, because let me show you what is in here as well. So this is, we talked about my public facing page. But the other type of assistance that we offer is energy assistance. Now, the reason why I, don't call it like financial assistance in the traditional way is that like cooling assistance and fueling assistance and the senior cool care, so that's crisis care, that doesn't run year round. So that's different than the TANF, in the fact that like that TANF payment would be something that I get every year. The energy assistance is different in that way. But yes, that is the only type of financial assistance that we offer. They sunsetted the program that we had for disabled adults that were either temporarily disabled or permanently disabled. So yes, that's the only one I had. Great questions. So while we're on that, well, we also have refugee assistance. I'm sorry. And that's for our refugees. One of the things I'll be sending your way, because I realize I've been talking, and how are you supposed to remember all these things, is this flyer, and it's available in several different languages. And so it tells people how to apply. We're going to go visit that website next. It tells people how to apply. It tells them a little bit about all the different programs that we have. MCCP, this is a Medicaid program for, it's a last resort program. So it's for completely undocumented children that otherwise meet the requirements. That call center I just told you about, here's some information about calling that number. Here's some information about the email address. And here's the public-facing website that we were just visiting. How to submit your documents. So several different ways also on this flyer. We already talked about this DFS My Case. People can fax. They can, we have these drop boxes. During COVID, we came up with this. We have these drop boxes that are outside each one of the offices, and people can drop off their documents there. It's like a mailbox where you wouldn't be able to like put your hand in there and steal anything, and it gets checked a couple times a day. But what I wanted to show you was that on the back of this is a little blurb about what each of the programs are, so you won't have to remember everything I'm saying. And I'm going to show you another place that has some information. So the other piece of this is that we also operate employment centers. At each of the offices, there's an employment center. We even have an employment center. We work very closely with SkillSource, way out in Prince William County, so even outside of our locality. And the one thing I will tell you about our employment centers, and I want to take you to their page really quickly before we talk about the application process. One of the things that you know kind of blessing in disguise that came out of COVID is that obviously we still wanted people to find jobs and help them do their work. And so one of the things that came out of that was that they started doing virtual consultations with people. And so you can, if it's somebody with challenges with, transportation, you can certainly have them, if you're looking at my screen, it says in-person and virtual services. So they can actually set up an appointment. The other thing that I want to make sure to clear up is that they have a lot of online webinars, and these are all the different programs that they have. So that's a lot for someone to figure out. And so that's why setting up that appointment is really important, because one of the things that's great about our employment centers is that they it's not a one size fits all um, kind of plan that they'll come up with. I can walk out with something completely different than all of you, just based on my education, my language. So that's something that's really great that I always like to make sure to make it a point to tell people, because it's not just like a one, okay, well, here, go to this class. Everybody comes out with a different plan, and so it's really great. All
Hey,
right, so how
Patty,
do yeah, go
we've
ahead.
got a question in the chat.
Oh,
Brooke is wondering, oh, well, sorry. First, Colleen is wondering,
uh-huh.
she knows someone living in a tent. Can they receive energy assistance for kerosene?
Um, no, I do not believe that that is one. No,
Okay,
that is not a
thanks.
covered one. So that would be one where we might leverage working with 222. And then I see another question in here
Mm-hmm.
about employment services for those with addiction challenges. So I'll be honest with you, I don't know that there's something specific to addiction challenges. And I also don't do the employment and services side. But Lindsay, if you'd like to have someone come and talk about like more in depth, somebody who's actually done that side of the work, I can connect you with somebody that they can come quickly
Sure.
and do that and give you a
Yeah,
little bit more overview, because
yeah.
I do know that there's not something there's not like a specific program. So like um, we have one that is specific for bridges to success, which it might fall under that. I'm not particularly sure if this is just for my TANF, and it might fall under this one. It might be this bridging one, but the bridges, but this is only for people that are receiving TANF. So that wouldn't solve your problem for a single adult, because someone receiving it, someone who's a single adult wouldn't be eligible for TANF. And so this is one specific to that. But yeah, I can connect you to someone that would give you, would be able to answer those more granular questions. That's no
That'd be
problem.
perfect. Thanks.
Yeah, great, no problem. All right, so how do we apply for all this stuff? So a couple different things. So let's go back. Sorry if I'm making you guys dizzy here. All right, so the public facing website, here's all of the programs we offer, and then how to apply for benefits. So you'll notice it says apply for online, and it's Common Help, or you can do it over the phone or get an application mailed to you. That was not by mistake. That was on purpose. I did that on purpose because the least favorable way to apply for benefits is with a paper application. And I'll tell you why. First of all, it is talk about wow. This is the application just for Medicaid. So if you had a family that wanted to apply for Medicaid, financial assistance, and SNAP, they're going to be filling out two different applications. And this application is just for two people. So if you, each additional person is an additional page that's front and back. And so, this is just, it seems very overwhelming, and I would hate to hand this to someone. It is about 10 pages long. This is the one for SNAP. And what's frustrating is that they both have this, like this, I'm asking for the same thing: social security numbers, how many people are in your household, dates of birth. And so this one is just about 12 pages. So again, it's why would we do that when there's an easier way? So let's go to the Common Help website. So this website, I will tell you, only translates from English to Spanish. So that would be something that you would want to be mindful of depending on who you were working with. But um, if you wanted to apply for just Medicaid or health insurance, you could do so by either calling this number or clicking into this box. And you would do, it's nothing that you wouldn't expect. Either creating an account, give me a username, password, some secret questions, or just log in with it if you already have it. One thing I will tell you that we leverage a lot is people always ask me about application assistance. Well, what's really great, and the other reason why we really promote calling over the phone or doing it online is that if I do it over the phone, the state has translators available. So imagine how many people we have that are not computer savvy. This person is going to take the application for me. Imagine how many people we have who, English is not their first language, or maybe they don't know how to read or write in their own language. So this has really been a great assistance to us in being able to leverage that and making sure that everyone has access to these programs. The last thing I'll tell you that is, and this is more of a both a benefit to the customer and to me, and it helps me provide better customer service, is that when they apply online or over the phone, they receive a confirmation number immediately and it pops up in my inbox. So I'm not, and I'm just being honest, if someone applies for on a paper application and they drop it off outside, somebody's got to go get it, somebody's got to screen it, somebody else is going to scan it, and then it's going to get assigned to a worker. Well, that's a lot of steps, right? And so we all remember, and we know people are like, oh, I want to make sure that it gets into the right hands. But this way, you could have them call the call center and say, did you get my application? Here's my confirmation number. And that person would be able to look and say, yes, we did. We received it. This application for SNAP, TANF, and Medicaid, and it's been filed and it's in the process of being assigned to somebody. So just like logistically, it works better in that way because we're able to, see it instantly for the customer, and it makes them feel better too because now I know I did because here's my confirmation number. Hi, Gwen. Gwen's my girl. We're always doing stuff. Once
Good
people
to
apply for
chat.
these, I know, right? Nice to see you. Once people apply for these services, how long does it take to receive confirmation that the services are approved? So great question. So all of them have different timelines. So for SNAP, if it is expedited, and by expedited, think of it like an emergency, for SNAP purposes, if their expenses exceed their income, most of my cases fall under expedited. So those have to be processed by 7 days. And for those, what's unique about that, and they will have gotten a letter that tells them that it's going to take 7 days. Now, what's unique about that is that I just finished telling you guys, well, I need proof of this and proof of that, and I need to verify all of these things. I can actually accept their statement for that initial issuance of benefits, and they have until the 30th day or till the end of the next month. And again, all this will be on the notice that they receive that tells them, okay, you have until I realize and recognize that you are in an emergency situation. I'm going to go ahead and give you benefits based on your statement, but you have until this day to give me proof. And if you do not, the case will close. If it's the case where it's not somebody whose benefits exceed, excuse me, their expenses exceed their income, those fall under regular 30-day processing. So we would have 30 days to verify that. And again, they would receive a letter in the mail telling them this is, you're either on the 7-day track or on the 30-day track. TANF doesn't is 30-day processing. It could be as little as 5 days if you decided to do some of that emergency assistance that we were talking about when I said, oh, if you had somebody who had a delay in receiving income, but we knew that income was coming, but this receiving a big chunk of it now would solve the emergency, so to speak, and keep them from getting on TANF. Those could be as soon as in 5 days, depending on whether or not the customer has turned in everything. And then Medicaid, that one is 7 days for pregnant women if I have everything to process the case. And then regular processing is 45 days. So different timelines. Different timelines. Um, Thank you for that question. The other thing I wanted to make sure that I showed you all is that, in the county, we have, what do I do with it? We rely on the neighborhood and community services kind of like as our catch-all, right? And so this is the human service resource guide, and so this would be another place that you could take people to for resources regarding like food, um, furniture. We kind of talked about like some other needs that I might not be able to meet through the services in our department, but this would be a great place to send people to. Now this one, and this is why I wanted to make a point of looking at it. So this only serves county residents, right? But we know people are transient, and we want to be helpful, and we're just like, well, no, you're not a county resident, sorry. And so to kind of supplement that, if we go to Common Help, there is a 222 number. Now this is basically the version of CSP, but statewide. So this would be a good place to send people to that don't maybe necessarily live here, or maybe they're moving around, but it works the same way. So you could do a couple different things. I've also chatted with someone on this, so this one also works as well. But you could do two different things. If you kind of knew what you were looking for, and I knew that I was looking for food, meals, so delivery, food pantries, you could go about it that way. And then you plug in your address would be one way that you could do it, by adding your location. So let's see what's over by Fairfax. So it'll tell me that there's a couple Western Fairfax Christian Ministries, of course, it's right over there by Chantilly. So it would tell you where everything was. What's great is that they've done a really great job of upkeeping this website. And so it's got information about kind of like what they might have, what they don't have, who they serve. It's got some description information, depending on which one. It tells you about languages. There's a lot of some of them, and again, it varies by which one, but some of them are very, very detailed in telling you about what they have. So, like for example, this one, I'll read to you what it says. Part of the application process, call and schedule an appointment. You must bring an ID for anyone that's over 18. School records for everyone school age in the household. So it's giving you kind of like a very like thorough, so people know what they need to do while walking in. So this, it's a great resource. And like I said, the difference between this and what we have is that ours is one that is restricted to Fairfax County residents versus the this one, which would be something that is statewide. Go ahead, Elliot. Oh no, Lindsay, there you are.
Yeah.
The box popped up in the wrong spot. Sorry. Go
It's
ahead, Lindsay.
okay. And I thought you were just calling me Elliot. I was like, I guess we're on that term now. I can't pronounce your last name, but yeah, anyways. So while we're talking about
Uh-huh.
who's eligible essentially, I'm wondering because I know that there have been like eligibility changes to SNAP. So I'm hoping that you can speak on that, like for our asylum seeker immigration or sorry, status, but also if there are any other major eligibility changes that have taken place in any of those services, are you able to kind of let us know prior
Yeah.
to looking at those services?
Yeah, so here's the let me see if I can pull this up. So when I talked to you, Lindsay, and we were talking because, and so what she and I were talking about was that I was like, "Oh, Lindsay, I don't know if you want to wait." I'm glad that we did because it changed like 2 weeks later. So yeah,
Okay,
so
good to
yeah,
know.
exactly. I was a little concerned because under the HR1 bill, when we originally saw it, um, it was basically going to restrict eligibility only to LPRs, COFA citizens, which is they're out in closer to California, or Haitian entrants with Cuban Haitian entrants, which we don't have a lot of. But the groups that were now no longer going to be eligible until they became legal permanent residents and had 5 years. That was what kind of was resonating across like the state, was the refugees and asylees, the parolees, the victims of human trafficking. All of those groups were now not going to be eligible until they got that LPR status and the 5 years. And so when I talked to Lindsay, I was like, I don't know, you may not want to wait because we knew that that was an impact to the community, and that we had a lot of a lot of those groups, the asylees and the SIV immigrant visa holders that had come over during COVID, and so I know that that was a big concern that these people were no longer going to be eligible. What happened and what has kind of was that states started to start file petitions and all this stuff, and so now it has reverted back to those
Okay.
folks are now going to be eligible once they have their refugee status. They're not going to, I mean, they are legal permanent residents, but they are no longer being held to that 5-year rule, which is what the
Okay.
concern was. So
Okay.
we are back to normal. We are okay. The
Okay.
big change now is those verification requirements. Um, that's
Mhm.
kind of been the big one there. There was, you may see it in the news. There were some changes to the work requirement age. So basically, under SNAP policy, if you are someone who was 18 to 64, previously 18 to 54, so that was the change. You had to either meet an exemption. So, like, think about like maybe you're pregnant, disabled, or maybe you've got a kid in the home that's under the age of now 14, it used to be 18. You have to be either working or doing some sort of activity that is going to move you towards gainful employment. And so um, the reason that also has been a change, it's called the work requirement under SNAP. The reason why that one is not as jarring is because it's not like everybody's just gonna now be subject to it. It's when your next renewal, maybe when you interview, that's when you and I are going to have a conversation. So it's a conversation. It's not just people being discontinued. It'll be a conversation between you and I and see, do you meet any of these other exemptions? Because if you don't, the issue with that is that then you are only eligible for SNAP for 6 months in a 36-month period. So that's where the time limited benefits. And I have a flyer for that too that I'll send your way, Lindsay, so that
Awesome.
you can share with people. But yeah, that was kind of what we thought was going to be big. But then we got direction from Food and Nutrition Services saying that no, it's been,
Okay.
they got clarification, and that now indeed these folks were going to continue to be eligible without that 5-year component.
Okay, thank you for that
Yeah,
clarification.
no,
And
sure.
it's interesting because you talked about, the whole verification process, and I saw
Uh-huh.
Gwendolyn put in the chat, to what extent does the complicated nature of applying for these services discourage people for applying for them?
I'm with you, and I'm with you, Gwen. And you know what? That's part of the reason why, when I started going out and talking to people, there was a lot of people like some of you guys, like people that I knew. So that comfort is there, and they're like, "Well, doesn't this make it seem like it's just harder?" It's like it's just making people jump through hoops. And I realized that that was why it was so important that I give you the background of like, well, how did we get there? It's not just that we're, making it more complicated. It's just that, this ensures that there is alignment between how I determine eligibility and how the feds
Hmm.
determine eligibility.
Hmm.
And it really is a disservice to the customer if I'm just taking their statement, while be it, you're absolutely right, right? We're asking them for more stuff. But what a disservice it is to them that because I took your statement, now you're on the hook and have to pay me back $1,200. Because imagine if you've processed your application and I gave you $100 too much, but you have a certification for 2 years. Well, do the math. Now you owe me about $2,400 because I haven't talked to you that whole time.
Hmm.
So, and another, that brings up another interesting point. People are always like, well, how do they pay it back? Well, there's different options. Um, they can have their tax returns garnished. They can pay back the overpayment using their SNAP benefits. So, like, let's say the overpayment was for $1,000. So they could say, okay, well, I'm going to give you back, instead of receiving $100 a month, give me 80, and then use that 20 to pay back towards the 1,000 that was part of the overpayment. Or they could just pay it out of pocket too. So yes, I hear you. I hear exactly what you're saying. Now I will tell you this, just to be clear. So like the things that we added that require verification are proof of medical expenses for anyone who is permanently disabled or over 60. proof of childcare expenses, and then proof of rent and utilities. Now, that being said, okay, if you don't turn those in, we're good. It just means that you're likely to receive less than what you're actually entitled to. But what if I have the things that are mandatory and not optional? So think about things like verification of your immigration status. I need verification of where you live, verification of income. If you give me those, and that's all that I needed to process your case, and you decide, you know what, Patty, I don't want to turn in my lease. That's just, or I get to the case on the 30th day and I see, oh, Lindsay hasn't turned anything in, but guess what? I have everything I need to process it. I can do that. And so she'll still, so it's not necessarily that it's making people ineligible. It's just that these optional verifications now need to be verified if we're going to give people credit for them. But I've got my core, and like I said, think about mainly like ID, um, uh, immigration status, where people live, and income. That's my core stuff that I always. That's like a mandatory verification. All these other things, it's at the customer's discretion about what what they have or what effort. I mean, also the other thing is too, I could on the 30th day process that case for Lindsay, and then she's like, oof, 2 months from now, she's like, I did get that verification of rent. I forgot to turn it in. She could turn it in and it would be a change. So then the worker would take that and say, oh, okay, I have verification now. They would go in, update it, and then send Lindsay a letter saying, hey, this is the new amount. And it changed because you provided verification of rent. And so it could happen that way. So yes, there's a piece of this where it's they are having to turn in more stuff. And like I said, uh, we've been accepting customer statement for I don't know how long. It's been 15 years. So it's unlearning that is the challenge, that I think the bigger challenge that's gonna be there. All right.
Hey,
I've got
Patty, I
yes,
have
ma'am.
Diane in the chat, and then we
Uh-huh.
have Brooke raising her hand. And I do want to
Yep.
give you 10 minutes on time because I would love for us to do community share outs towards the
Okay.
end.
So let me do
Perfect.
Diane. So just to be sure, asylees and others will not lose benefits. No, they weren't. And the LPRs won't need to be here for 5 years to receive benefits. So there is a group that do have to have the 5 years, but the asylees and the LPRs are the ones that we were worried about, and they do not. There's like children under the age of 18. There's a list of exceptions that of people that don't have to use wait that 5-year rule, but the majority of it is those kids under 5. Anybody who has worked or has a spouse that they can borrow that has worked here at least 10 years, as long as it's a is that would person would be exempt as well. They wouldn't have to. So imagine I've been here with a work permit for the last 20 years, and I finally get my LPR card today. I would be somebody who would be eligible for SNAP because I've worked here for the last 20 years. And so they what you'll hear about it called is like if they have 40 quarters. I always just say 10 years because who would that's eligibility talk. But it's yeah, they call it the 40 quarters rule. Basically you have to earn, and that's determined by Social Security. You have to earn a certain amount of money per quarter in the year for it to be a countable quarter. And so as long as you didn't receive benefits in that quarter, that would be a countable month that you get credit for. So again, all those things are the things that I figure out on my end when you and I talk. But those are the big ones: the asylees, the refugees, kids under the age of 18, and then those folks that have worked the 10 years. There's another list, but they're just not as prevalent, if I'm being honest.
Hey,
Um,
Patty, does
uh-huh.
LPR stand for legal permanent resident?
Yes, ma'am, it surely
Okay.
does. And it's
Okay.
also, but you know what? I'll be honest with you, it's more famously called green card holders.
Okay. Okay.
Yeah.
Thanks.
If you were talking to somebody, yeah, you green card holder. Yeah.
Okay.
Go ahead, Brooke.
Thanks.
Sure.
Hi, thank you. I just want to say this has been a fire hose of information, but so clear and so concise. This has been one of the better presentations I've been a part of. So thank you so much.
Oh, thank you for
I
having me.
I do want to ask one clarification. I might have missed it in the beginning
Okay.
trying to get in.
Uh-huh.
So, and the services that you were talking about, NCS is county only, 211 Virginia is statewide.
Correct.
Can you explain the difference between PAES and CSP?
Oh, so CSP, they do everything. Those they were
Well, it
definitely
sounds
they
like
do
you do
everything.
everything too.
No, they just don't. I mean, they offer more services. And basically, from my understanding, and I've never, and this is just for me being nosy and talking to people over there, but that's social workers, proper social workers, where they do an assessment. They even do assessments for determining long-term care services and supports. So think about people who might need in-home care or just need a little bit more than just Medicaid, where I'm going to the doctor, right? This might be somebody who in-home nurses, maybe they're in a facility. So they do screenings for kids for that. So they do everything. They basically will just do an assessment of what are your needs, what's your situation, and then kind of do refer out. So the difference between them and me is that I'm determining eligibility based on state and federal policies for programs that are offered across the United States. So it's federal programs. Whereas, I mean, I'm sure Prince William County has some version of CSP, but they may not. I don't know. And so, but what they do have is SNAP, Medicaid, financial assistance, energy assistance. So that would be the difference. Is that they're local. They offer local services, and I am state. So no matter what county, they're going to
Got it.
offer those same services.
Got it. Thank you so much.
No problem. My pleasure. And then, is there any wiggle room on expiration of ID to pro residency? So the ID itself can so let's say like a driver's license. I can have an expired driver's license and use it as verification of identity. What I can't have is an expired like uh what's it called? I can't provide a expired green card or a legal permanent resident card and say, well, here's my proof of residence. Now, that being said, I have systems on the back end that I might be able to check and and do it that way. But if it's an expired card, while I can use it to verify their identity, it will not serve as a verification of their immigration status, if that makes any sense. That will need to have, so I can do it for one, but not the other. The other thing I'll mention is that we require verification of ID, so of their identity. But as counterintuitive as this sounds, okay, that does not need to be something with their picture on it. So the state allows some flexibility. I mean, it's not my first, again, with all the fraud that is going on and people applying on people's behalves and people don't even know it. It's not my go-to, but I can use things like a pay stub. I can use a voter registration card. I can use a social security card. So again, counterintuitive because proof of ID, but there's not a picture of your face on it. But it's something that I can certainly do, and that would be again what we would discuss in the interview. If you tell me your house burned down and you don't have anything, well, guess what? The best thing that we can do in your situation is maybe take a customer statement, your a statement from someone who knows you are a third party. So we would explore all of that. Yeah.
Awesome. Thanks, Patty. All right.
Sure.
We've got a couple minutes left, and I want to provide some time for community sharing. So, any other pertinent information that you feel like you want to send us off with?
No, just thank you so much for having me. I offer information sessions. So if you think any of this information would be valuable, please don't hesitate to reach out to me. I was teasing Lindsay because I was like, what do you want? I was like, do you want 15 minutes? Do you want the 20 minutes? Do you want 30? You want an hour? I could go for 2 or 3 if I needed to, because we have so much stuff. But I say that to say, if it's a shorter amount of time, I can certainly adjust the information. But yeah, look out for information from me. And then again, feel free to hesitate anytime you have any questions. Um, and I'm happy to help. I rather you have a place to ask questions than just be guessing. So let me know.
Awesome.
Okay.
Thank you. Yeah, does anyone have any last questions for Patty? Just want to make sure we got all the questions. All right. Well, thank you, Patty, so much for your
Thank you.
time, for
No
that awesome
problem.
information.
No problem.
And like Patty mentioned, she will be sending me all of those links and resources that she referenced in this presentation. That will be sent to you along with the meeting link since we are recording the meeting. So give me about a week or so. Our communications team has to get the video together and then you'll get all that information. So thank you again, Patty, so much. I really appreciate you. You're
No
so
problem.
awesome.
Never,
Um,
no, never problem. You guys enjoy the rest of your meeting. Have a good.
Thank you.
All right. Bye bye.
And you're getting some thanks in the chat too. All right, awesome. I hope you all found that very informative. But I will now open up the floor. If you have any upcoming community or interfaith events or you would like to share out anything, now is the time to do so.
Lindsay, if it's okay, I would like to go.
Yeah, go right ahead, Sadat.
Okay, great. Yeah, thank you very much. So, team, my name is Sadat Laik. I'm the Public Affairs Secretary for the Ahmadiyya Muslim community. And for the purposes of this call right now, I'll represent myself as Humanity First. Humanity First is a nonprofit organization that does great things locally as well as internationally, and I volunteer for them. So in April 17th, 18th, and 19th, we are going to be hosting a health and wellness clinic. And as part of that clinic, we're going to be offering a few different services. We're going to be offering free medical on site at the Mubarak Mosque, which is in Chantilly. We're going to be offering free dental services, and we'll be offering free vision. Um, with the free vision, we will have a mobile lab that is going to be on campus. So there will be lens manufacturing and also uh, the um, the possibility or the ability for individuals to go and select the frames that they like. So on April 17th is when we are going to be setting things up. 18th and 19th is the clinic. Again, that is over at Mubarak Mosque, and it is it's being led by Humanity First and Remote Area Medical. So if anyone on this call has been to a RAM site or a remote area medical site, the RAM people are amazing. They do God's work. I was at one of their clinics in Harrisonburg, Virginia, about a month and a half, 2 months ago. And what I saw out there was just fantastic. So I wanted to have that um, in Fairfax for the communities that could use those services. Now, in order to make this event a success, this thing is sort of multifaceted, right? There's the offering these services to the community that needs it. And then there's the let's get all the different faith communities to come together and volunteer and do our part to take care of people in our community, those that need service, right? So success for me or for us would be defined as getting practitioners, doctors, logisticians, engineers, technicians, business people, all the people that we can get from the different faith groups. And if we can have them over that Friday, again, Friday is the setup day, and Saturday and Sunday is when we're going to be doing the clinic. If we can have all of us there, that would be fantastic. So I'll follow up with Lindsay to get her information, and I would appreciate if that could be shared out with the larger community that is here. Thank you.
Definitely. Thank you, Sadat. Yeah. And there's already been an ask if it will be in the newsletter. And I said if he submits it to me, but Sadat and I talk frequently, so even if he
Yeah.
didn't want or if he forgot, I would remind him. So yes, we will make
Yeah.
sure.
There's a lot of work. There's so much happening. We are engaging with Fairfax County Health, and there are many non-government organizations that are expressing interest. So it's just a lot happening right now. Engaging with those NGOs, talking to the different faith community leaders, and yes, we got to do uh, the the newsletters and all of those things, right?
Mm-hmm.
That's important. We got to get the message out. So would very much appreciate that you guys can do that. I want to say one more thing. We are also looking for sponsors, partners, and volunteers. All right, thank you.
Thank you. Awesome. Great information. Anyone else want to share anything going on coming up
Sure.
soon? Hi,
Yeah.
Ariana. Yes, introduce yourself and then
Hi.
share.
Hi, everyone. Thank you so much, Lindsay, for inviting me. This was such a really great experience. Just seeing all these faith communities come together to help the community, even with their particular health needs. But my name is Ariana Garvin. I represent HWPL. We're a peace organization who works with religions, with policymakers to work on sustainable peace. And I wanted to join the call today because I see all of these wonderful leaders in faith who are working to help their communities. And so we also want to be a resource for everyone as well, for opportunities to um, spur each other on, if you will, with even scriptural dialogue. We invite leaders to come to various events where they have the opportunity to share about their beliefs, as a way to be supportive of that aspect, as well as you all are serving your communities. And so we have opportunities coming up in February where our International Religious Peace Academy will be happening. And we would love to have Fairfax County represented on a broader scale to show unity as well. And we also have our weekly dialogues on Fridays at 9 a.m. Where we have leaders from the different religions answering just different questions, some things as big as things about health and wellness, and some things as small as, trees. But it's just a way to show that we're all unified and we want to help the community to be unified in that way. So if you're interested, I can share my email in the chat, and I also did submit some of the events that I mentioned for the newsletter. It'll go out next month. But thank you so much again, and I'm looking forward to continuing to meet with everyone. Oh, sorry, Lindsay. I think you're muted.
Wow, I was just talking and talking. It's 2026 and I'm still talking on mute. Love that. Thanks. Ariana, I just put those two events that you referenced in the chat so people can hold that as a save the date. But yes, I will be including that in the newsletter that will go out for February. And Trish, come off mute. It's so wonderful to see you this evening. No, we can't hear you. You're off mute, but the sound's not connected. You want to use the chat maybe? Okay, we'll let Trish use the chat. Man, Trish was struggling to log in and now the audio. Thank you for sticking it out. Does anyone else have any community updates, events, invites to share while we wait for Trish in the chat?
Lindsay, can I put another one out there if that's okay?
Of course, of course.
All right. So Ramadan is coming up, and on the 28th of February, we will be having an interfaith, and that's going to be at the Mubarak Mosque. And Lindsay, I got you. I am going to get you some type of a communique for that so that we can get that out to the rest of the team here.
That sounds good. Thank you, my friend. Yes, I have it marked on my calendar. So
Wonderful, wonderful.
yes, I'm excited. Okay. Oh, Trish was asking about event details. Go ahead, Ariana.
I was about to ask the same thing. You could share details about when the iftar will be.
Will do. We
So it sounds like save the date on February 28th around sundown. So I would do it around just after 5 p.m. Don't put anything on your calendar, maybe. That sounds about right.
That's correct. Yeah, 5
Okay.
p.m. So 5 to 6 is, so we intend on doing 1 hour of presentations. So
Okay.
we're still working those mechanics. Who's going to speak, right? I'll be hosting it. I know that part.
It'll be great because
It'll
you're
be
doing
great.
it. It will be. It will be.
Yeah, thank you. I appreciate that. So this year's theme is Voices for Peace, and we are looking for speakers. Didn't mean to put anybody on the spot here. So stuff to think about, but yeah, it's from 5 to 6 are speeches, and then 15-minute break, 10 to 15-minute break for prayer, and then after that we'll have a banquet. It'll be fun.
It sounds like an awesome time. Thank you
Yeah,
for that invitation.
you're welcome.
All right, Gwen.
So, Lindsay, I have a question to ask you. You had
Sure.
started the meeting, you mentioned some event where you needed a location, Herndon Reston.
Yeah, so I was going to wrap up with that information, but I can go ahead and share it again. So, as a reminder, our next Faith Communities in Action meeting is going to be at 7 p.m. on March 17th. That's a Tuesday, and it will be in person. It will be in the Herndon Reston area. I am working with one house of worship. They may not be able to support the meeting though. Um, so I did put a call out to see if there were any other houses of worship in the Herndon Reston area that could host and provide light refreshments such as coffee, tea, some type of snack, just because it is in the evening. But once I do have a location confirmed, you will receive that meeting detail through the newsletter. Perfect. And I see Regina has already sent me an email of interest, it sounds like. Thank you, Regina. I will definitely follow back up with you. And then one other event that I wanted to share, this is on behalf of a colleague or a connection that I've made over at Mason. They offer well, I would say this specific office for psychology services provides mental health care for individuals through 4 steps. So there's some information about what they offer there. I do also have flyers, but I'm unable to add them to this chat right now. So I'll make sure to include those flyers in the follow-up email from this meeting in case you would like to learn more about that mental health care. Anyone else have anything they would like to share? Okay, I'm gonna wait because it looks like Ariana's in the chat. Perfect. Oh yeah, Ariana, I can connect you and Sadat. Or I mean, you guys are here, so you can put your emails in the chat if you'd like to. I think Ariana, your email is already in the chat, right? And then um Sadat, you have like 5 email addresses, so
So
pick
many,
one.
right? Yeah, I'll put both the Ahmadiyya one as well as the HF, the Humanity First one, if that's okay.
Okay,
Yeah.
awesome. That sounds good. And then Catherine, I see you have a question. Is it only for George Mason students or for anyone? To be quite honest, I am unsure. I received this information, like I said, from a connection that I had made, and he asked me to share this information with you all. But what I can do is send out the flyer. If that flyer still doesn't have enough information for you, or even if you want to just connect with that person immediately, please feel free to reach out to me directly, and then I can connect you with them for more information. Thanks for your question, Catherine. And thanks for joining us. I see several new faces on this call. So not only just to Catherine, but everyone else that's been, that's joined this meeting for the first time this evening. Thank you so much for joining, for sticking it out during a little, dinner time, a little later. I really appreciate everyone's, their effort, their attention, and their dedication to supporting Fairfax County. So I appreciate you all. Thank you. And I see there are other people in the chat, but okay, maybe we're saying goodbye because that was my wrap up. I will hang on just in case Regina and Snow want to continue typing their messages. Oh, it looks like Regina might have a speaker for you. Sadat,
I
awesome.
like it.
Thank you
I like how
all.
this is coming together. This is wonderful.
Yes, it's
Yeah,
awesome. All right.
fantastic.
Thank you all so much. I appreciate you. Have a great rest of your night.
and a great rest of your
Thank
week.
you.
Thanks. Take care.